On today's show, we're discussing the emerging advances in Lyme disease diagnostics and prevention. This is the JAMA Medical News Podcast. I'm News Director Jennifer Abbasi. Associate Managing Editor Kate Schweitzer is here to talk about her story. Kate, thanks for joining.
Thanks, Jen.
So Lyme disease remains surprisingly difficult to diagnose, prevent, and treat. Where does the state of care stand now?
Right. Lyme disease is the most common vector-borne illness in the United States, and cases continue to rise as ticks expand into new geographic regions. Although about 89,000 cases were reported to the CDC in 2023, experts estimate roughly 476,000 people in the U.S. are actually diagnosed and treated each year. So despite that growing burden, experts told me the way we diagnose and treat Lyme disease has changed remarkably little since it was first recognized nearly 50 years ago. Clinicians still rely on antibody-based blood tests, which can miss infections early on, and for most patients, treatment remains a short course of antibiotics. Those therapies work well for the majority of people, but one expert told me that we've made far less progress in areas like early detection, prevention, and post-treatment Lyme disease syndrome, or PTLDS. The encouraging news is that researchers are pursuing a broader range of strategies to improve care.
Okay, so let's start with diagnosis. Why has diagnosing Lyme disease remained so difficult?
The biggest challenge is timing. The standard blood test detects antibodies, not the bacterium itself, and those antibodies can take weeks to develop. That means patients can test negative early in the infection, even when they have Lyme disease. And not everyone develops the classic bullseye rash either, and early symptoms like fever, fatigue, and muscle aches overlap with many other illnesses. And delayed diagnosis matters because it increases the risk of developing PTLDS, which can leave patients with persistent fatigue, pain, and cognitive symptoms. That's why so much current research focuses on better diagnostics. Scientists are developing tests that can detect bacterial DNA or antigens directly, while others are studying immune system biomarkers that may identify Lyme disease earlier or even predict who's at risk of developing PTLDS. One expert described earlier diagnosis as one of the holy grails of Lyme disease research.
Prevention also seems to be seeing some innovation. What's happening with vaccines?
For the first time in more than 20 years, a new Lyme vaccine could be on the horizon. Some listeners may remember Lymerix, the first Lyme vaccine, which was pulled from the market in 2002 after disappointing sales and concerns about possible adverse effects. Now, a new vaccine candidate developed by Pfizer and Valneva has completed a phase 3 trial and is under FDA review. Experts say it's an important step forward, but they also raised practical concerns. The vaccine requires 3 doses over 9 months, plus a booster. And some researchers question whether people will commit to that schedule, particularly considering protection isn't immediate or long-term, and as the tick seasons continue to lengthen.
Now, vaccines aren't the only prevention strategy researchers are studying, though.
That's right. One promising approach uses a monoclonal antibody that could provide protection within days instead of months, making it attractive for people with short-term outdoor exposure. Researchers are also studying an oral version of lotilaner, a drug already used to kill ticks in dogs and cats. The idea is that it would kill ticks soon after they attach, well before they've had enough time to transmit Lyme disease. Experts said these different approaches could eventually allow prevention to be tailored to an individual's lifestyle or risk.
So are we on the verge of reducing Lyme disease?
Experts are more cautious than optimistic. Most of these technologies are still years away from routine clinical use, and Lyme disease will likely continue expanding as tick populations spread into new regions. And they also emphasize that ticks carry many different pathogens, so vaccines targeting individual ones alone won't solve the bigger problem of tick-borne diseases. For now, the most effective prevention strategies remain the simplest ones, using EPA-registered tick repellents, wearing protective clothing, checking for ticks after spending time outdoors, and removing attached ticks promptly. As one expert put it, those measures work. The challenge isn't the science, it's getting people to consistently change their behavior.
Thanks, Kate. All right, if you'd like to learn more, we'll include a link to Kate's story in the show description. This week, we also published an article on the latest global immunization coverage estimates and potential challenges ahead. You can find that and all of our stories at jamamedicalnews.com. Thanks to Kate Schweitzer for joining me. I'm Jennifer Abbasi. This episode was produced by Daniel Massisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.